Hey everyone, Luke here at Total Performance Physical Therapy. I'm here with another video talking about another common cause of knee pain. And what I wanted to talk about tonight was about your meniscus and your meniscal tears and what causes them, how we treat them, different approaches to handling pain caused from meniscal tears. So probably all of you have heard of the meniscus and tearing your meniscus, and probably some of you might have some idea of what it is. Some of you are kind of a little foggy, and some probably it sounds like a foreign language to you. So I just wanted to provide this video a little bit talking about meniscal injuries. So just a couple quick facts. The meniscus tears is the second most common knee injury there is, so it's very prevalent, and about 80% of MRIs that are taken of your knee are taken to see if there is a meniscus tear in your knee. So very prevalent, very common to see. So what is your meniscus? Well, the meniscus, and actually I might be able to find a picture here. Here's a good one. So this is your knee joint, and it's a little backwards, but that's okay for our purposes. So here's the front of your knee, and here's your meniscus. Is this part that's kind of, so this is your upper leg, your femur. This is your lower leg, your tibia. And here's your meniscus sitting right on your tibia. And it kind of goes all the way around. So this is the front, it goes around to the back and actually makes two half ovals on each side. And what the purpose of your meniscus is for shock absorption. So it's a shock absorber. It helps distribute the force of gravity and your body weight coming down through your knee joint. And that's the main purpose of your meniscus, or menisci. And so how do you injure your meniscus or tear your meniscus? Well, one way is through a traumatic way, and that's usually what happens is if you're playing a sport or if you're doing some sort of activity where you're cutting and you're putting this stress and load through your knee with your knee bent, and then there's some sort of twisting motion that occurs. So your knee's bent, it's loaded through your body weight or other force, and then you twist, and that causes that tearing motion. And it's common for when you tear your meniscus to actually tear what's called the unhappy triad. So ACL tears and medial meniscus tears as well are common to see with tears, or medial collateral ligament tears, so the ligament that runs along the middle part of your knee. So those three things, the ACL, the medial collateral ligament or MCL, and your meniscus can all kind of tear together sometimes, and that's called your unhappy triad. So that's one way to injure your meniscus, is through a traumatic means, cutting while playing a sport with a bent knee. And you can also tear your meniscus just from degeneration and aging. So it's this is obviously a lot more common the older you get. To basically just that wear and tear can cause tearing of your meniscus in similar ways that the older you can get, you'll start to have some tears in your rotator cuff as well. So just another things to think about with your meniscus. So like I said, it's kind of these two ovals. So if you're looking down from above, this is what the meniscus on each side would look like, is this oval shape on the bottom of your knee. And the interesting thing is the outer third, so the outer portion of it, gets a good blood supply. And what that means is that it has good potential for healing if you tear it. The inside portion, so the inner third, so this portion on both sides, that has a poor blood supply, so it doesn't get good blood, doesn't get good nutrients to it. And that means it has less ability to heal itself and repair. So that's something that's going to come in as we kind of talk about different treatment approaches. So what kind of signs and symptoms might you have if you tear your meniscus? Some of the big ones is you might have some catching or locking of your knee, so you might not be able to extend it all the way, or you might have some clicking or catching as you bend and straighten it. You might have some tenderness and pain along the joint line, so along that middle part of the knee, right where the meniscus sits. You might have some pain with trying to straighten the knee all the way, or catching. And you might also have pain with deep knee flexion, so bending the knee as far as you can at that end range. You might have some pain as well. And so there's a variety of different treatment approaches depending on the extent of the tear, where you tear it, your activity level, how old you are. All those things play a part into what treatment will happen when you tear your meniscus. So there's first option is conservative treatment, so that's physical therapy usually, doing things for strength, range of motion. Depending where the tear is, either it's not significant enough to impact you functionally or pain-wise, and so they'll just do the physical therapy, or it might be in an area where it has that good blood supply on that outer portion, and we just use the physical therapy, allow it to heal itself as much as it can, and then hopefully return to your prior level of function and decreased pain. Another treatment approach is having a meniscectomy or debridement, and basically this happens if the tear is significant, if you're a little older in age, and if it might be a tear to that portion that might not have as good a blood supply and not have as good an ability to heal itself. And so with this, basically all you're doing is the surgeon goes in there arthroscopically and removes the part of the torn meniscus to basically just take it out of there. And same thing after this, you'll go usually have physical therapy, range of motion, strengthening type exercises, and usually the recovery is about 2 to 6 weeks if you have a meniscectomy or a debridement. Another option is having a meniscus repair, and so what this will be is usually for someone who's younger, more active, and really needs that functionality of your meniscus, needs that shock absorption. They can get a meniscus repair, and the thing with this is it's a little bit more recovery timeline, so it can be 12 to 16 weeks even, and this is again is for your younger patient, a tear that might be in that vascular zone that has good potential for healing. The surgeon might decide to do a repair. And then the last option that we don't really see as much is transplantation, so meniscus transplantation. And this is kind of a last resort option that meniscectomy might not be a viable option, and the repair might not be effective, and so we might go with something like a transplantation of the meniscus. And this is usually again for someone who's older, you don't have any signs of osteoarthritis, good alignment of the knee. The transplantation may be an option. So that's kind of my brief summary of meniscus tears, what causes them, what you see with them, what the different treatment options are. I'm sure I can go into a ton of more detail, but I just wanted to give a general overview of what it's all about. And if someone says something about their meniscus to you, you're not, getting that foggy sensation and something that's completely over your head. You can kind of have some idea of what they're talking about, and maybe can give them a little advice one way or the other, or at least tell them what you've learned. So that's my video for tonight on meniscus tears. Please be sure to check out, we have a knee pain workshop coming up in March, and I believe it's March 15th. Yep. March 15th, knee pain workshop here at the Hatfield location in the afternoon. I believe it's 2 to 3 we have it scheduled for. We have a lot of other great things going on, so be sure to check out the Facebook page. I'll put a link in the comments to sign up for the knee pain workshop and check it out as well. Alright, so thank you very much and have a great evening.